myself before, but my name is Danielle Walker, and I'm also on the board of We the People Value Community. And it's my absolute pleasure to be here tonight. I'm going to pull up this chair. Hopefully. All right. Let's see how this works. Okay. Well, before I introduce the panelists, please note that there are cards on your chairs, and they're for questions. So if you have a question that comes to your mind during the presentations, please write them down. You can bring them up here to me, or you can give them to any of the volunteers that are walking around. Marina?
You can give them
okay. Give them to Marina too. Okay. And the cards just help us be more efficient with time so we can get more questions in. I think we did it last time and we were able to get pretty much all the questions in, and that was like a miracle. Okay, with that, let me introduce the esteemed panel. These ladies represent a lot of fire and fight for truth and justice and liberty. And we're so blessed to have them with us this evening. First is Dr. Kathy Willis, right here to my right. And Dr. Willis is an internal medicine physician, and she has had a distinguished career. She served in the LSU hospital system and more recently with Louisiana Healthcare Connections as a medical director. And she was fired for not taking the COVID vaccine, and since then she has become an outspoken critic of the mandates, and she spends her time advocating for common sense, freedom-minded policymaking. And as an aside, I don't know how many of you are familiar with the State of Freedom podcast. It's a podcast I co-host with Chris Alexander, but Dr. Kathy Willis has gone out of her way for us. She has been an absolute incredible resource, and she has connected us with some really, really amazing guests. And so Kathy, I just want to thank you so much for all that you have done for us. You've been a sounding board and such a friend, so thank you. Next up is Dr. Kat Lindley, although she's joining us by Zoom now, and so I'll introduce her just before she comes on, which will be a little while from now. And then last but not least, Kathy Edmonston, Representative Kathy Edmonston. If you joined our mixer last month in June, you might recognize Kathy. She was here with us for that. She's been so gracious to join us again. Tonight she's going to answer any questions that might come up about where Louisiana's laws are on issues that are brought forward by Dr. Kathy and Dr. Kat, and she'll help us understand where the gaps are so we know what we need to prioritize fighting for next session. Representative Edmonston has been an avid champion for health freedom in this legislature. This year, thanks to a conservative legislature and a conservative governor, she has finally seen the fruits of her labor after years of toiling under a tyrannical governor. So we're so proud to finally see that come to fruition. She comes to us from Gonzales. She represents District 88 in Ascension. She's serving her second term in the state legislature, and before that she was on the BESI board, the Board of Elementary and Secondary Education. Her background's in education, and she's been a great voice for that as well in the legislature. So thank you, Kathy, for joining us. I'm just going to also make one more shameless plug. I can't promise that this will be the last one, but if you haven't listened to the State of Freedom podcast, go ahead and subscribe to it right now. You can pull out your phones. All three of the guests tonight have been on our show, and I know that they will leave you wanting to hear more from them. So you can check out their episodes on our podcast, and if you have a pen and paper, Dr. Kat Lindley's episode, I wrote these down, was number 148. Dr. Kathy Willis is 180, and this is not going to be a confusing evening with representatives and all Dr. Kathy, Dr. Kat. So y'all just bear with me. And Representative Edmonston's latest one, because she's been on a few times, is number 181. Okay, without further ado, let me hand the floor to Dr. Kathy Willis. you. Okay. Is this all right?
Yeah, I think it's on.
Your guess is as
What do
good
you
as
think?
mine.
Well, it's, okay, it's just, it's not.
No, I
it's
just want
on.
to make, yeah, no, I just want to. It just wasn't screwed in all the way, make sure.
Yes.
Electrocute. Hey y'all, how are you? So great to be here. I can't tell you, I just feel so at home amongst you guys. I'm from Bogalusa. Do I need to stand? I can stand some. Bogalusa is a small place. Y'all know where Bogalusa is? It's the Stinky Mill place. Anyway, I loved growing up there. I loved growing up in rural America, I guess you could say. And this is just, you guys are what that is to me. I was driving down here and I was like, wow, this feels really good. It feels relaxing. I live in Ponchatoula now. It's not like I live in a big city, but still, you know, I should have worn my jeans and stuff because you guys are just relaxed. Y'all are my people, and I can feel it. But I want to give kudos to this group. I have seen this group in action over the last several years, and what great organization you guys have here. Y'all have done some amazing work, and I've been super impressed with this group. This is one of the major groups in the, amen to that.
It is
So I know I'm limited on time, and I didn't press start, so I need to do that on my timer here. But I want to say something about Kathy Emerson and about what somebody else was mentioning about feeling alone, you know, not knowing anyone or who to talk to or who you could talk to early in the beginning of the pandemic. I felt the same way too. I thought I was the only one. I was one of 7 doctors where I worked that was seeing things differently, and, you know, questioned myself numerous times. Am I going crazy? I really don't know. I mean, it seems like pretty evident to me what's happening. But after a while, okay, but one of the first people I met was Kathy Edmondson. My niece was going to PA school, and they were trying to force her to, Madison Misley, trying to force her to, I can't believe it, I remember if it was the shot or the mask. Anyway, she called me and she said, can you talk to this representative for me, or with me, you know, about what's going on at the school? And lo and behold, it's Kathy Edmondson. This is the first person, the first government representative or official, whatever, you know, you want to call her, superstar, that was speaking out.
Say government.
Don't say
Yeah, the government.
Okay, people advocate.
Yeah.
There you go. And so I was like, wow, this, I'm not even seeing, no offense to the men, but it was early on, and there really was a lot of women
Yeah.
in the, and I couldn't understand, you know, I don't think early on maybe some of the men, maybe in my circles, except my husband, really understood, because you kind of did have to go down the conspiracy hole a bit, right? And that's kind of a, you know, woman gossip thing maybe. I don't know. So, Kathy, thank you for that. I don't even think Maddie was in your area. I mean, she was helping people all over who she didn't even truly represent geographically. And so she was just a true inspiration to me, and really gave me the courage to get out and speak, because I was really nervous, because, you know, something must be wrong with me. Nobody else is saying anything. But let me back up just a little bit now that I've said that, and those kudos to her. When Marita and I talked about what to cover, we thought it would be a good idea to kind of go over kind of how we got here. And so I'm going to cover sort of that, and how it affected doctors, and, you know, what did and maybe didn't they realize. And then Dr. Lindley is going to come in and kind of take it from here, the World Health Organization, and, you know, the trajectory of where we're headed. So let me just start by, let's go to 2020. And the pandemic is hit, right? And I have some slides, but this first stuff, I just need to give you some historical background. So when COVID hit, I was working at one of the Medicaid plans. It's, you know, insurance. We're looking at charts, looking at records all day, making sure our Medicaid patients are getting great care. And so here we are with the pandemic. Thought it was completely just, real, and that it was just it just naturally happened. I was all into the microbiology, the cellular level stuff of the virus, and I was really trying to understand how it worked, how it affected the body, how did it attack the body, what could we do about it, therapeutics and things like that. And then I started doing some education for the nurses and the other folks at the where I worked. And so that was pretty much all of 2020, and I was just so into it in that way. I wasn't hearing anything else that was weird. I wasn't on those channels, and that's an important piece, I think, because what channel you were on in the beginning was going to affect the trajectory of your perception from that point on, right? And so my perception and my trajectory was pretty much the same until the election. So we get to the election in 2020, in November. Boy, did it seem really off, right? And my husband and I talked, and we just couldn't fathom that we were that far off base, like how we felt how society was going to vote. And so, to make a long story short, I was following this guy online who was determining all the algorithms that had been in play. And it was super clear to me. And you could even look at it yourself. The data was published online, and you could do the math, and you could see that the percentages in certain precincts were the same throughout the night. That's not natural. Anyway, so it was pretty clear to me that the election was not legit. That led me to an alternate channel. That's where the information flow changed for me. So when I got on those different channels, meaning alternative social media, news, things like that, that's when I started to hear, rumblings of COVID and the vaccine, and it's a bioweapon. I'm like, this is nuts, but then I started paying attention because things aren't adding up. So that's kind of how it started for me. I don't know why I closed this. So then 2021 comes around, and I'm starting to understand that something is very wrong. And then the messaging that is starting to come out, over the first 4 or 5 months, I was going to be a trial participant for one of the vaccines. A colleague of mine was running one of the studies in New Orleans, and so I felt like I needed to do my part, all right? But then again, we start hearing there's some safety issues. So I start researching, looking for evidence that there is indeed a problem. And on PubMed is a website where you can find all kinds of research papers and where people are reporting case reports of injuries. There is a ton. I couldn't believe it. This was, the first few months in, and why aren't we talking about this? Why isn't the CDC reporting this? Why is this medical journal that I get in the mail all the time that I don't pay for? That's, interesting. I get several of them that I don't even pay for. Why aren't they talking about it? And why are they shutting these people down? Why are they saying this is misinformation? But y'all, it was really clear. Then I started seeing it myself in, either my neighbors. I had a neighbor die, a 32-year-old die. He got a very rare blood disorder after the vaccine. He had a 2-year-old child. That was actually in the newspaper with the clinical record showing that it was vaccine related. So I was very disturbed, obviously, right? So then, my point that I want to get across here is that several doctors, people think doctors were all in on it. That's not true. Doctors were fooled most, just like the rest of the public. We were especially conditioned over decades. When I started to realize just how awful of a situation that we were in, I was just, completely blown away and just distraught, really, because it was going to change my life and the world the way I saw it forever, right? And so, excuse me, I need a smaller bottle, or maybe a cup. Thank you. All right, so how did we get here, though? How did it happen to where we were all, our medical training, our research, how did we get there to where it was corrupt and we were just sort of fooled? This is the part that I think that we all need to understand, because if you understand it for the healthcare sector, you can take this information and you can apply it to every other sector in our society. Education, legal, what else, Kathy? Anything, because it's everywhere. I was not paying attention. Thank you. I didn't like politics, so I never watched. I never went to the Capitol and saw all of the way that these bills were being discussed or disputed or not passed. It was just, I was in shock and I was ashamed. I was ashamed because I had not been paying attention and really felt like it is my responsibility now more than ever to do whatever I can. I got a lot to make up for, right? So just one thing about work, I did tell them all of this information that I had found. I did tell them that the corporate office was distributing information that was inaccurate to the 70,000 employees worldwide. I gave them a 2-page document with the corrections of the information that they were distributing, because they were saying things like, if you take the vaccine, you won't get COVID. And this was clearly after the CDC, even Rochelle Walensky had said it can't prevent infection. So that did not go over very well, which was weird to me, because I'm a doctor and I'm telling you that this medical information that you're saying, this is a medical company, is incorrect. But I got fired. Is that weird? Right? And imagine how I felt, or how anybody felt early on, because nobody's saying anything, and you're the only one saying, "Oh, she got fired. It must not be true," or what she's saying must not be true. So anyway, let's see. And I did not fill out a exemption. Thank you. Because I felt if I did, this is always a question I get, why didn't you? Because that to me would send a message to the 600 employees in Louisiana that, yeah, that's right, that it's really just a medical thing or a religious thing, and it wasn't about that. It was about, I was seeing injuries, and I'm not gonna act like it's about anything else, because it wasn't. Okay, can you go, two more. Okay, so what were the things that I noticed that started making me wonder, like, okay, how did this possibly happen? Again, yeah. Because if COVID was supposedly all coordinated, this would have to be this massive coordination worldwide. I'm like, there's no way that could happen, right? The CDC would have to be involved, FDA, and there's just no way. I can't believe it. So I went on a mission to prove myself wrong. And all I did was prove it all right. Okay, so what you're looking at here, this is up to date. Up to date is a website for physicians or healthcare providers. It's a subscription where there's all the latest and greatest medical information is here. So I said, okay, let me see who wrote the section for the COVID vaccine. So pulled it up. There it is. So it's Catherine Edwards. She wrote the section. So I went to see her disclosures. Well, she works for, let's see, CDC and NIH. She is on numerous boards for pharmaceutical companies. Sanofi, Ex-Pharma, Moderna, Pfizer, Merck. She received millions of dollars in grants from the NIH, NIAID, CDC, and the WHO. I'm like, wait, this is a conflict of interest. So I emailed them. Yeah, and I said, this seems to be clearly a conflict of interest, and I'm sorry I didn't put the email in here, but they wrote back and they said they evaluated it and they don't see it as a conflict of interest. Okay, next. We're gonna go pretty quick. Okay, so this is her. Just again, this is.
Another Kathy.
Yeah, how about that? Yes, and so again, this just shows, some of her work and her expert consultations at JCDC. Okay, next. Again, here, COVID-19 vaccines, it just has her listed. Next. Okay, and so then to my surprise, not really at this point, I guess, I was like, okay, this is not surprising anymore. She's quoted in several articles along with Dr. Fauci throughout the pandemic. So her and Fauci quoted in the same article. What are the chances of that? I mean, so not only that, they were also doing conferences and things together, the video Zoom conferences. Okay, so I'm like, okay, maybe there is something to this. All right, so there was definitely connection. You can go to the next one. This is her later, I think this was 2023, testifying under oath. Yes, sir, I've been an advisor to Pfizer, and I've been working very, very closely with Pfizer, particularly their COVID vaccines, and going over lots of reactions and adverse events. So yes, I am working and being paid by Pfizer for my assessment of vaccine safety. Those are her exact words. Okay.
Wow.
That's
Crazy.
Isn't it? All right, now let's talk about how did this get into, how did all this narrative get into Louisiana? And I forgot to start the thing, so you just have to tell me. Forgot to start the clock. How did this information trickle down? So we're captured in our medical resource or references, right? I just showed you that. Doctors are looking at information by someone affiliated with the CDC and the WHO and is being paid by the pharmaceutical companies. Fine, all right, that's one piece of the puzzle. But how did all this narrative about vaccine misinformation, all that get into Louisiana, into your parish, into your city, into your state? Let's walk through it. Back up one, sorry. Okay. So the Department of Health was putting on these Vax Matters podcast. I would listen occasionally, but then I decided to start digging, of course. And so I clicked this link on one of the ads. It brings you to an immunization page on the LDH website. One of the resources you could click under COVID-19 vaccines was building confidence in COVID-19 vaccines. Next. So I clicked that, and this brings us to this page, COVID-19 information. How do you address vaccine hesitancy? Well, de Beaumont, remember that? De Beaumont, we're going to get to that. From concern to confidence, how physicians can build trust in COVID-19 vaccines. So the Department of Health gives us a link to Beaumont. Next. This is, when you click on that pamphlet, this is it from Concern to Conference. They basically are just telling the doctors, this is for the doctors, they're telling you what to do to get people to get vaccinated. Get vaccinated, ask your staff to do it, post the posters everywhere, post it on social media, make COVID-19 vaccine a new vital sign, collaborate with trusted messengers such as priests, pastors, businesses, okay? Send emails. Next. They even have the messaging for you, right? Messaging that works. They've done the research, right? They've polled people, they've done all the psychological research, that they're highly effective. These are the things that they say you could say. The COVID vaccine will help protect you from getting sick. This one just really irks me. The quickest way for life to return to normal is for most people to get vaccinated. Nearly all doctors who've been offered the vaccine have taken it. Do you think they asked all doctors? No, that didn't happen. Okay. No one can say that in this pamphlet, no one can say for sure if there will be any long-term effects. But there's no reason to think that there will be. And then lastly, you can sign up for misinformation alerts by the Public Health Communications Collaborative. All right? So this is just highlights of that. Next. Just remember some of these names that you're hearing because we're going to cover those again. Talking to patients, they want you to be very direct, okay? They are also going to give you sample letters, emails, communications, and there's some other resources that you can go to. All right, next. So, de Beaumont, changing the COVID conversation. Again, this is a resource that doctors can go because they've done polls, messaging, and language resources to build support for public health measures and vaccines. All right, and so we're going to get to who de Beaumont is shortly, but de Beaumont. In 2020 and 2021, partnered with Frank Luntz. Do you know who Frank Luntz is? He's the Republican pollster, Republican, in quotes. Thanks. Okay. And he worked with the data intelligence company Morning Consult. We're going to get back to this, but de Beaumont is the one that put a target on physicians' backs. The No License to Lie Coalition or whatever. That was one of the most terrifying things that I can recall seeing. It was a true, I mean, you just felt like you were a sitting duck target, especially if you were speaking out. Next. So who is the de Beaumont Foundation? According to, I'm sorry, I can't see my influence watch, I'm sorry. It's kind of cut off at the bottom, but anyway, it's a nonprofit, left progressive private foundation supporting aggressive and intrusive public health activism. Why is this on the Louisiana Department of Health page as a reference for all of Louisiana, conservative Louisiana? Okay, next. Let's just take a look at Morning Consult. If you remember Frank Luntz, worked with Morning Consult, right? Morning Consult is a global decision intelligence company. So how is all of this happening globally? Well, you have major foundations that have billions of dollars that they're giving away money, who are also global, right? Working with global data companies, working with a pollster, Republican pollster. You know, where could we go wrong here? Next. I'm sorry.
No,
Good?
you're good.
You good? Okay.
Dr. Kathy, you have 10 more minutes. So I don't want you to rush.
Oh.
Oh, we're giving you extra time.
Okay. Oh, thanks. Cool. All right. So if you go to the Morning Consult page, just so you can get a feel of who Morning Consult is, this is what you do. You find who is putting their hands in, and then you go look them up. Follow the money, follow the people. So Morning Consult, this is some of the headlines on their page. Federal agencies exit COVID-19 public health emergency with majority of the public's trust. You feel that way?
No.
Okay, I didn't think so. More than half of U.S. voters say they plan to get new COVID-19 boosters this year. That was at the end of last year. Recently, Harris is uniting and energizing Democrat voters and polling better against Trump. True or false? Okay. Some health workers are considering quitting, moving over abortion bans. So, you can just take a look at some of the headlines, and clearly this isn't necessarily a conservative agency, right? Okay, so far we've got 3 or 4 foundation. We've got a foundation. We've got this other business organization. We've got a pollster who's known not to really be a Republican, and that's where the information is coming from on our Louisiana Department of Health. Next, but wait, there's more. Yeah. Okay. So, if in one of the other slides, they said sign up for the misinformation alerts, right? Through the Public Health Communications Collaborative. So again, they're gonna, you can't figure it out, they're gonna help you. They're gonna tell you what to say. They're gonna tell you how to answer the tough questions. And they're gonna tell you how to address misinformation. All right, next. So who is the Public Health Communications Collaborative? It was formed in 2020, at the end of 2020, by the CDC, the De Beaumont Foundation, and Trust for America's Health, to support and enhance the communications capacity of health departments across the country. So I'm trying to help paint the picture here of how, because I couldn't understand it. How did this happen? How did it infiltrate everywhere? Every state, every country, every city. This is how. Okay, keep going. CDC Foundation, it is not a government organization. It is an independent nonprofit. Its goal is to mobilize philanthropic and private sector resources. Although it was created by Congress, which was kind of confusing, but it still operates as an independent nonprofit. Next. Learn something new every day. Oh, I have learned something new every hour since 2020, I'm telling you. So the CDC Foundation, who are the biggest donors in 2023? Bloomberg Philanthropies, the Bill and Melinda Gates Foundation, and Bill Gates Gavi. All right? So far, do you have any organizations that you feel comfortable with giving information to LDH? My guess is you probably don't. All right, next. All right, so it started coming to light that, hey, the CDC is being influenced by these corporate political interests. You think? A little bit? Yeah, I think we got a big problem. Next. So who is Trust for America's Health? It's also a nonpartisan public health policy and research and advocacy organization that envisions a nation that values the health and well-being of all, and where the prevention and health equity are foundational to policy making at all levels of society. Who funds it? Well, the CDC Foundation. I mean, wait a minute. There's money's going back and forth. It's like all this money laundering business. I don't even know how that's, how's that legal, Kathy? I don't know.
I thought the CDC was a government agency.
Well, this is a CDC Foundation, but I don't know.
Oh, this is different.
This is
from
the foundation.
CDC. Oh, okay.
Yes.
I beg your pardon. Okay, good. Oh, that makes me feel better.
Okay.
So we've been hoodwinked more than I thought.
Now, and the other ones that I have circled there, these are organizations or entities that I just find sort of are common in some of these organizations are NGOs, non-governmental organizations. So this is one pamphlet, you guys, one pamphlet. We have got DeBeaumont, we're gonna get to a list of those in a minute, but let's go ahead to the next one. But you see what I'm saying? And it starts to get really convoluted, right? So you probably kind of lost, like I don't remember, who the CDC Foundation was about and who they partnered with. But isn't that the goal? You can't keep track. We're gonna make sure of it. Okay.
Sorry.
That's okay. All right, so Trust for America's Health. Ready or not, 2024, protecting the public's health from diseases, disasters, and bioterrorisms. Now, here's their claim. As the nation experiences an increasing number of infectious disease outbreaks and extreme weather events, our Ready or Not 2024. Okay, so their goal is to protect. They want to identify key gaps in national and state preparedness. And by the way, they say Louisiana is one of the least prepared. That's fine with me. And they make recommendations to strengthen the nation's public health system and improve emergency readiness. These are the people going to Representative Edmondson. She wouldn't meet with them probably. But these are the people that are going to your senators and our elected officials and making suggestions on policy changes that need to be implemented in your state. You better believe they're coming for Louisiana because we're one of the states that's least prepared, according to them. So what does that mean? That translates to me, we don't have the laws on the books that they need to make things happen the way they want it to happen here. 5 minutes, okay. Next.
Sorry.
That's fine. No. So we just hit the tip of the iceberg there, but look at all of these other tentacle organizations, groups, initiatives affiliated with DeBeaumont. This isn't even all of them. Okay, so we've already shown that they have tentacles with all those other organizations. There's a whole page full, okay, that we haven't even looked at yet. You could look up all of those. Next. Okay, this DeBeaumont is the one who published this 28-page document targeting physicians during COVID. This is who, see, this needs to be, they need to not be on LDH's website. I don't know if they're, well, I did click it, it still goes to the link. So we need to talk to Abraham. That has got to come off. We can't be targeting our physicians who are trying to speak up. Anyway, so basically what they did was encourage public-private partnerships to monitor and investigate doctors. Some of our doctors were investigated by the board. Some got fired, some got, what do you call it?
Have their license taken away?
Well, I don't know about, no, but, yeah, suspended, things like that. Whatever. I got fired. The board didn't come after me, but I guess I wasn't at the Capitol that day when they kind of went after that group. Next. Okay, so what we have is all these organizations that are connected to each other, right? And the money's flowing everywhere. There's plenty of money. They're funded by billion-dollar organizations. So we have that piece. The next piece, the strategy is, let me capture your young leaders. This is the MO. It's in their playbook everywhere. They're going to award you. They're going to take you to a conference. They're going to applaud you, and they're going to lift you up. I'm not saying that Dr. Cantor had anything to do with it. I'm just saying he was recognized, right, by DeBeaumont. DeBeaumont 40 under 40. Next, please. All right. Also, Astos is got to our state. Our LDH is still participating with them, but understand, even though it may seem like a good organization or a good thing to have a group of people talking and deciding maybe best policy for certain situations, it takes one bad seed at the top of a good organization that has an umbrella across the United States to then capture it. So this organization next, of course, you know, we saw the cancer's part of that. This is state-based public health, and then they really get down into the parish levels and the other local city levels as well. So that's how information kind of flows way, way down through ASOS. That's just one. You know, then they have their funding mechanisms, just like we discussed with all the others next. Okay, that kind of covered this. Let's see. Okay. So just so you recognize here that they work on development of plans, priorities, statutes, ordinances. They're helping develop laws, okay, for the states. And they're going to propose that. All right, next. All right, so who is influencing Louisiana Department of Health? Just based on that one pamphlet. All of these organizations or people or businesses, and from those, there's the tentacles going everywhere, and it is extremely difficult to keep up with who is who and what other connections they have. Next. Okay, so this was, this is just going to be brief, but that's part of how I just wanted to describe how I just started discovering how this all played out. What we just discussed, that was all being built for decades, right? Okay, so let's, Rockefeller, let's go to the next one. All right, so he, in the early 1900s, right? If you haven't heard of the Flexner Report, we'll talk about that here, yes. He was researching how to turn petrochemicals into pharmaceuticals, and we know how that went, right? Here we are today with it. His biggest threat was natural medicine. He started getting into the medical schools, making donations to the medical schools. Then he commissioned the Flexner Report with the Carnegie Foundation. And basically, that destroyed natural medicine. I didn't know any of this, y'all, before COVID. I was so naive. Okay, wow. I just, very not smart. Okay, next. So this is a Flexner Report. Okay, go to the next one. Let's see. I wanted to let you know though, people were pushing back on that. They were not, this isn't from the newspaper in 1910. Plot by Medical School Trust is doctor's charge. So what they were saying is that the doctors felt like this was unjust, and that it was the ideas it contains will develop in the convention of the American Medical Association. Rockefeller had a great influence on the American Medical Association. Donated a lot to them. Yes. So the key changes brought about by the Flexner Report: standardization of medical education. I won't read all the small print. Reduction in the medical schools. Okay, so you're concentrating the medical schools. Shift to scientific medicine, which is evidence-based medicine. When I was in residency, I'm gonna hurry.
Okay.
When I was in residency, this was really becoming a thing, evidence-based medicine. Okay, Dr. Willis, on rounds. Why are you prescribing amoxicillin for this patient in room 506? Well, because the evidence shows in the literature, Professor, that amoxicillin works best against this particular type of bacteria, blah, 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 whatever. So you see what I'm saying? We had to prove that the treatment we were giving had evidence to support it, right? Well, it sounded good to me. I mean, why wouldn't that be a good thing? But it's not good when your research is corrupt. Because if the pharmaceutical companies are funding the research, people are going to give them what they want. I wouldn't have believed for a second, y'all, that healthcare, because we care for people, that people would really not care. It is, and it's so unfortunate. Next. Okay, then other ways Rockefeller, got into medicine. He developed this new medical institute, the Rockefeller Institute for Medical Research. So here we go. This is the start of pharmaceutical company research. Next. That's just his gift to the, American Medical Association. Next, World Health Organization, just brief, I think I got 2 slides. That's it. All right, and so just the background of the WHO, because I didn't really know, why was the WHO established? Well, this is why. It was set up after World War II as a health arm of the UN to improve, improve health globally. But it's evolved over time to basically cater to private funders. Bill Gates, the same people we all are aware of now. Next. And these are just their public-private partnerships. This one, I just thought this was interesting. The WHO has stated that pandemics occur just once per generation over the past century, and killed a fraction of those who die from endemic infectious diseases, yet they still attract much corporate and financial interest. Like, it doesn't make sense, right? I mean, it's not about that. And that's what I've learned over the last 4 years. Next. So basically, it's global governance disguised as global health. Is that it? Okay. Just a couple more. So in my research, I'm like, okay, are they really trying to depopulate? Is that real? I mean, it's hard to believe, right? And so the WHO Task Force, that's okay, on vaccines for fertility regulation, its formation, objectives, and research activities. It was formed in 1971. Next. And then here we go, development of immunologic methods of fertility regulation. This was a 1987 paper. So they've been working on it forever. Next. Okay, I think Kat's going to talk about this. This is really the last thing. H5N1 bird flu, the current situation. So sometimes you can go to the CDC website and sort of dispel fears and things. So this is from today. They're saying it's out there. Next, and this is the last one. So they're monitoring it, right? But look at what it says. CDC influenza surveillance systems showed no indications of unusual influenza activity in people, including avian influenza. So when the Weather Channel sends you an alert to your phone saying, oh my God, it's spreading everywhere, it's probably just some gaslighting going on. And it's just, you just go to the CDC website. We don't really trust them either, but why is there this discrepancy here? But anyway, I could share 1,000 more slides with you, but that's all I have time for.
I listen to you.
Okay.
No, this is just Kat.
All right,
Yeah.
she's got it.
Thank you, Dr. Willis. Next up is Dr. Kat Lindley, who is joining us via video from Texas. Dr. Kat, thank you so much for making this work. Dr. Lindley is originally from Croatia. She's a highly regarded family physician and the founder of the Global Health Project, which is an alliance of organizations, experts, and advocates dedicated to enhancing and safeguarding global health. Dr. Kat, I hope that you'll tell us more about that in your talk, but I think it's important to note here that your organization really advocates for personal responsibility, grounded in truthfully informed decision-making, and I think that's something that is going to be very interesting to the group here tonight. So with that, Dr. Lindley.
Hi, I'm the only one you can see right now, but we've got a big group of people here. Say, is there a way for you to unmute yourself?
Yes.
Great. Okay, I'm going to turn this microphone on. And can you try to speak? Say hi.
Sure. Hi, can you hear me?
They said yes. Oh. There we go. You're welcome.
So, thank you for having me tonight. So I'm Katarina Lindley, and I was born in Yugoslavia, which now is Croatia. I left when I was 18 just before the war started, I lived under communism when I was younger. So I left when I was 18. One day before split was attacked, and I went to live in Italy, and eventually came to the States. Went to school here, became a doctor, and then I've been kind of, even before COVID hit, doing a lot of things outside of the system. I've always felt that socialized medicine, Medicare for all, is a way of introducing communism in the country. So even before this pandemic, I actually worked with President Trump's administration on several healthcare bills, and I have a good relationship with a couple of congressmen from Texas and I know my senators. So we did a lot of work on I'm a good believer in free market medicine because I feel that if people have choice, the market tends to balance itself, and it helps take away the narrative of that government has to be in charge of healthcare to allow people to make their own decisions. So when COVID happened, I was living in private practice. I do direct primary care, so I don't take insurance. So I was learning how to do things on my own. And I am friends with many of the frontline physicians, so I kind of did my own things with treating patients and making sure that I keep my patients out of the hospital. And then maybe like 6 months, a year into it, I decided to start speaking out with some of them. And I always spoke up about, since I look at this differently, I recommend the strategies, the isolation, the fear tactics, the bargaining credit with mandates and vaccines and masks. I understood that because that's kind of what you do in totalitarian regimes, right? You isolate people, you make them fear something, and then you start bargaining, and if they don't comply, then you push for mandates. So I started speaking up about really mandates being an attack on the republic. And in my opinion, the republic has fallen because of the mandates. And we might be able to right itself up if we do the right thing in November. But I truly feel that we already are very much further along the way than most Americans realize. Because of that, I looked at the World Health Organization and the narrative that is coming from around the world. We have allies, and we a lot of times agree with our allies, but we don't share the same messaging. And messaging, I speak several languages, so I was always interested to see what's happening from other places. And messaging was the same, build back better, right? The words are exactly the same no matter which language you were listening to. And this kind of indicated to me that the world needs to watch and see what's happening.
Kat, excuse me, is there any way you can try to speak louder or turn your volume up on your computer? Just checking.
Sure, my volume is up. Is this a little bit better? And I'm sorry, I don't speak too loud. I'll try to switch my settings. But anyway, my point essentially is that I started watching the global action. And because of that, I watched the World Health Organization. And what World Health Organization did very early on came up with this idea that sorry, I'm trying to work on the microphone while I'm talking. They said that there was a new pandemic, and because there was a new pandemic, we need to make sure that we create the pandemic treaty, and then along the way we started renegotiating the international health regulations. And for the past 10 years, we've been doing exactly that. What someone realized is by doing that, they were also trying to bring two things at the same time. It was a true attack on sovereignty in terms of things they were trying to accomplish. Because by allowing the World Health Organization to be in charge of our health and by they wanted to also tell countries how to respond to those pandemics, which would include vaccine passports, closing down the country, limiting trade in the country, closing the borders, things like that. So this past May, they renegotiated international regulations. They were not as bad as we feared, but they're still bad enough because they talked about increased funding, increased surveillance, and more censorship. And currently they're negotiating the pandemic treaty. And most likely they will have some kind of a Dutch treaty soon. Interestingly, if you're watching the news and following on Twitter, you'll see that I talk about bird flu a lot, not because I'm scared of it, but because I recognize that they will use it for a next pandemic, and I'm convinced it's going to be bird flu. The reason I'm convinced is because it's a perfect setup for One Health. It allows for this idea that we can transfer an infection from animals to different species of animals, then to humans, and eventually from humans to humans, which by the way hasn't happened. The cases that we have so far are mainly in poultry, in Colorado and a couple other states, and some in dairy farms in Texas, in cows, I think in dairy cows, actually. The human infections that we're having, they were mild, mainly conjunctivitis, and there was no human-to-human transmission. So they haven't achieved the narrative. But despite that, first of all, they have 3 vaccines, which are old technologies that are not great. And then they have a new vaccine that University of Pennsylvania came up with, and Moderna is working on, which is the mRNA vaccine. The HHS just paid Moderna $176 million. Yesterday, Sarah, which is our Health and Human Services Secretary, amended the EUA to cover the bird flu. And I reported today on Twitter that AMA, which is the American Medical Association, has issued new ICD-10 codes to cover for bird flu vaccine. All of this is really significant because it's significant that we're about to have another pandemic. And not in the true sense of the medical word of pandemic, more in pandemic, which is the kind of organized pandemic. And I don't think anyone is surprised here that this is happening just as we are about to have elections. So essentially and I know I was told there are some representatives here in Louisiana have done some amazing job when it comes to World Health Organization. Essentially what we need to do is continue the work that Louisiana has started doing and making sure that states follow the 10th Amendment and don't allow the federal government to interfere with the health care of the citizens of the state. And with that, I'm done, and I'm sorry that my voice is not great.
Thank you, Dr. Kat. That was a great overview, and the info on the bird flu is a little unnerving. Just not, as you said, not because anybody needs to be afraid of the bird flu, but people need to be afraid of the government, I guess is really where we stand. Well, with that, why don't we start with a little Q&A? Does that sound good to everybody? All right, well, maybe Dr. Lindley, since you just joined us, a question for you. A major focus of your work is to unveil the truth for people. What advice do you have for people who are seeking the truth for their own medical conditions or concerns, or really about anything? How are you and how can they discern and identify the truth?
So I do something called direct primary care. Direct primary care is a type of practice where I don't take insurance. My members pay monthly membership fee. It's actually very affordable. It's anywhere from $35 to $110 a month, and the patient has 24/7 access to it. Now, I'm not saying for everyone to do that necessarily, but I do have a very unique relationship with my patient. It allows me and them to trust each other. I would say, the things that happen after this whole thing is people don't have any trust in doctors. And I get it, I totally get it. But I always keep on telling everyone, if you have right blood, and this is like a very simple example, but if you have a right lower blood pain, with fever, maybe a little bit of nausea, you're not hungry, the thing is getting worse, I really hope you go to the hospital. And I'm not going to be facetious, but at the same time, doctors have to restore the trust. So I would say for people on the other side of that medicine is when your heart rate is down, you don't take it anywhere. You interview or you hear from your neighbors what you think about the mechanic, how much it costs, and you afford it. Is the person likable? Kind of do the same thing, interview the doctor, but make sure that you find someone you trust now. I do feel that bird flu is going to be shoved down a road. I know we're not going to fall for it, but our government is going to fall for it. And we need to make sure that we have good representatives, like you guys have, with Representative Edmondson and Senator Presley. You guys have some true medical freedom champions. We need to make sure that they are our defense, right, when it comes to legislative issues so that the states don't do mandates yet. I think that's really important. So I'm running for school board. I've done this before, I'm doing it again. But I think it's important to be involved on a local level because ultimately your local leadership is going to be your line of defense. So we have, I forget what we call them in Texas because we didn't have them in Florida. But anyway, like, if our judge, whatever, something, can close our county, even if our open or close the county against the governor's order, which is good and bad, right? So they're like good people to do stuff like that. So I think it's kind of the same thing with health. You need to be involved on the local level, and then when it comes to your own health, I keep on telling people, you don't need to be taking ivermectin, hydroxychloroquine, all of these fancy things all the time. What you have to do is eat healthy, sleep, exercise, drink lots of water, take vitamins if you need them. Because if you have a strong immune system, no matter what hits
Yes.
your immune system will do what's supposed to do. God created us specifically for our system, immune system to handle these things. Sure, sometimes we need a little help, but essentially, the work starts at home.
Thank you. Great answer. Representative Edmonston, you've been awful quiet over there. I'm going to call on you now. Based on this past session and what you've heard tonight, which I know we've all learned some new information, but some of it you probably already knew as well. What gaps do you see that need to be addressed by our legislature next session?
Well, I just think we need to be diligent, as Dr. Lilly said. We just need to make sure that we have our eyes and ears open, that we listen to alternative information as opposed to government information. I mean, I'm not trying to be a conspiracy theorist, but I think Dr. Willis has shown us that we can't always trust what the government tells us. So it's incumbent on us, like Dr. Lindley is saying, for our own health, to do our research, to come to groups like this. This is one of the best groups, even though my sister is Vicky Fluchain. This is one of the best groups in the state. And the number of people that are here is very gratifying to me because that means that you are not a woke group, that you are a group that is really wanting to dig for the kind of information that you need in order to fight against what is coming possibly and against misinformation. They said we had misinformation. We had the right information. They had misinformation. But I think that we know that, so we're going to keep our eyes and ears open. I guess you're going to let me talk about my vaccine bills and that kind of thing.
Yeah,
Whatever. Yeah.
You
Go
go for it,
down.
yeah.
Yeah. So I feel like our state years ago, several years ago, 10, 12, maybe even 15 years ago, had an exemption clause in our policy that said if you do not want your child to have a vaccine, any vaccine, that you could write a sentence and say that you dissented and you wanted your child not to be vaccinated. For years, I worked in a school system. I know many people who were in a school system. I know many parents. I know myself. And I know that we did not know that information. So early on when all this started, Kathy, as a matter of fact, and several other people, we would get together on the phone, y'all, in the morning, remember? And we would just, can you believe it? No, I can't even believe it. Well, did you read this? No. And so we were just our own little cult, dispelling everything that we were being told. But anyway.
And praying.
And pray, that's right, we did pray. And so, but we did have the exemption policy in place, but we did not, it was in law, but we did not, our public, our parents, even our school systems did not really know. I don't think they did, I don't think they were on purpose, but when a parent would go and ask about it, they would say, no, you have to get the vaccine. So one of the first things I wanted to do was make sure that we got into statute that this was what we could do. You could opt out, and I wanted to make sure that the schools were sending out, when they sent out information about vaccines, the required vaccines, that they would send out the information about opting out. I mean, that's just a transparency thing. So I tried, got vetoed, then I tried, and we went into an override session, missed it by 2, but that was under our Democratic governor, and they were all in for the vaccines. I'm sorry, it's just the way it was. But this year, because we have Governor Landry and a very conservative House and Senate, I was able to get that bill passed. So now when schools send home information, when schools send home information about the required vaccinations, they also have to needs to contain the little word that says you are able to opt out. So that was House Bill 47, I believe. House Bill 46, I was able to finally pass. I carried that just one session before. And that just simply says no more mandates for COVID-19 in schools. And as Dr. Lindley said, this is what, it's not, you can do what you want to about the vaccinations, or so-called vaccinations, whatever people want to do, because I believe that we ought to have personal choice. Yeah. But the point is, I lost my train of thought. What was I saying? What? Mandates, yeah. The problem is mandates. The problem is the government saying this is what you have to do. And I don't know about y'all, but I'm a little rebellious. And if somebody tells me I have to do something, I'm going to figure out a way that I could possibly get out of doing that. So anyway, so every school in the state of Louisiana, no more COVID mandates at all. So I'm very, very proud of that legislation. Thank you. And then I wanted to tell you about a bill that we didn't pass that has to do with health freedom, and that was our bill that said the FDA drugs that have been approved, but doctors can prescribe those drugs for other conditions. What am I saying? Off-label prescriptions. And our doctors wanted to prescribe many of them, ivermectin and hydroxychloroquine, but they were told by their medical boards and the commissions that they couldn't do it. So, and the reason this didn't pass is because some in our legislature, and some of them are Republicans, they just didn't want to. They didn't want to pass this because, you know, we need our boards, we need our commissions, we need them to oversee what we're doing. No, we don't need that. We need doctors to be able to have a relationship with their patients. And I'm sure Dr. Willis and Dr. Lindley both agree with that. So I will be bringing that back, and it will pass, because I will do my homework, and we will make sure that we have everyone on board sitting in their seats to vote. So, okay, so that was that one. Now, I want to talk about the WHO bill. So, last session, we brought forth the same bill that passed this session, SB 133, and that simply says that the World Health Organization, the United Nations, and what's the third entity? And the United Nations have no jurisdiction in the state of Louisiana. I wanted to tell y'all that we were so good, we tried to pass that the session before, and it fell apart in committee because we had people that, I'll tell you why it fell apart. In addition to what I just said, we included the Center for Disease Control. And the CDC, everybody was having a nervous breakdown. They said, oh my gosh, we won't be able to have money for mothers to get formula. I mean, they're going to come in, they're going to take all of our federal funds that we need to run our health units, which is not true. It is absolutely not true, but that's what killed that bill. So this session, Senator Presley had the foresight to bring that back, and I co-authored, and Senator Valerie Hodges co-authored, and we were able to get that. And he did not have one single bit of problem, and I was thinking, what's wrong with me? But anyway, the point is, we got it passed. So that is something, we are premier in that. I don't think there's any other state. Is Dr. Lindley hearing us, or could she hear us? Do you know if there's any other state, Dr. Lindley, that has passed the legislation on the WHO and the UN like we did?
I believe Oklahoma. Oh, maybe. Yeah.
They presented it, but I don't think it passed. Do you know?
Yes, Oklahoma passed it actually.
Okay.
And Texas is going into legislative session in January.
Right.
And we already have Senator Bob Hall, who is going, actually I believe he's filed already, but he's definitely going to submit one, and then my representative is also going to submit one.
And that would be in Texas?
Yes.
Okay, so Oklahoma already has passed legislation. We've already...
Florida has one as well. The Florida one is not great because it kind of allows, I believe, the governors to have input. It was written yearly and it was passed 2 years ago, so it's not the strongest Georgia. Georgia has been the strongest one, and I believe everyone is pretty much copying the Ghana language.
Okay, I guess maybe that's what I was thinking about, that Oklahoma has something that's not quite as strong as ours. But anyway, we let out of that, and I think it's amazing that we were able to do that. I just hope other states, like Dr. Lindley.
I'm trying.
We're working you, aren't we? But anyway, so we, I don't know if I have this, but can y'all hear me? Yeah. Here, it went back in. But anyway, I hope other states will take our legislation. We've been contacted by several other states. I hope they pass it, because y'all, obviously, of late, you've seen what our government looks like and what we will go to any lengths to do to take out the people that we believe are standing with us. So we can't rely on our federal government. We just can't. It's falling apart. And so if we don't take care of ourselves in the state and take care of ourselves locally, it's going to be bad. So I know that I'm preaching to the choir. I know that y'all all know that. But we've got to do what we need to do in our state for our people.
Yeah.
So just on the, okay, in regards to what was done with the WHO bill, based on the information that I showed today and how these outside organizations that clearly are biased, in that same vein, Kathy, can we structure a bill to prevent that sort of intrusion into our state government? Because those are all tied in with the WHO. I mean, that's the WHO funnels this information down, and so these organizations are just, playing that role. And getting themselves on our Louisiana Department of Health, information page. And so, we shouldn't have these biased organizations being the ones to provide the Louisiana public with information that they feel is right, their misinformation. So can we do that?
Well, I believe that, do y'all all know that Dr. Cantor was really sort of the head of I don't know if you had said that, I didn't hear you if you did, but anyway, he was the head of Department of Health. When Governor Landry got in, we now have Dr. Ralph Abraham. Some of you probably remember he ran for governor. He's a doctor. He's an excellent, he's just got excellent character. We're very, very fortunate to have him. So I believe that we have his ear. If there are things that are going on that we feel like are, and I know you've met with him and that kind of thing. So I don't think it will be the same. I really don't. Under Governor Landry's leadership, under Dr. Abraham's leadership, I do think that we will not have information that is indoctrinating in the way that we had it before. That's not to say information won't slip in, but again, what you're doing tonight is the best way to make sure that you are getting the right information. Surround yourselves with people who are like-minded, who are not believing everything they hear, and make sure that you take away what they're presenting to you. These meetings are excellent. I mean, nobody has the kind of meetings that this We the People group has in terms of getting the correct information that we need going forward.
And Representative Edmonston, one thing you didn't say about your WHO bill failing last year was that it was the LDH who came out and testified so hard against it. And so the LDH, I mean, to your earlier point, has not been on our side. This year we did pass legislation that says that in the case of an emergency, a state of emergency passed by the governor, the legislature can, one house of the legislature, one chamber can go and say, you know what, we disagree with part of the state of emergency, we disagree with all of the state of emergency, and if it's a public health emergency, they don't have to consult LDH now. So I think while I think Dr. Abraham's profile has risen because he's been named Surgeon General, the LDH's power as a government entity hopefully is reduced somewhat.
Absolutely, and I do believe that we will have information that is produced that is not biased like it was before. But I also believe this: if people have concerns, I believe that they will be heard and they will be acted on as opposed to before. I can tell you that my off-label bill, LDH was at the table with me. Dr. Abraham wanted that bill to pass, and because of the committee, we were not able to get it done. So we're looking at a whole different setup with LDH the way it is now.
Okay, well, let's get into some questions, and if we have some time, I'd like for you to also maybe go over some of the bills that Representative Amity brought.
I have those with me, yeah.
Okay, perfect, but I want to get into some questions. This one is for you, Representative Edmonston, and it's, I think you touched on it, but maybe if you have anything else to say on this. Can our state legislature bring forward the bills related to this that our prior governor vetoed? I'm guessing related to the pandemic and mandates.
Well, my two bills, he vetoed twice, so yes, we can. We can bring any bill back that did not pass. And I know that in this session, a number of legislators, both senators and representatives, brought back bills that had been vetoed. So yes, we can do that. We certainly can, and we will. We need to hear, you need to contact your representatives and senators, maybe if they had something that didn't pass that you want to see passed, and just recommend, would you bring this back? So yes, the answer to that is yes. Mm-hmm.
Okay, thank you.
Mm-hmm.
I guess this one may be for the doctors. Can you speak about the quote-unquote sudden deaths, blood clots, and turbo cancers, and will the creators of this ever be held accountable for this health crisis they created with the vaccine bioweapon?
I can give you personal testimony that I saw with my own eyes, records. This was very much happening. So if that's the question, was that the question? Was it whether or not it was actually happening?
I guess will people be held accountable, do you feel?
Well, I really thought that we might have seen something by now, but it's very disheartening that we haven't yet, but perhaps we're gonna get there. I mean, there's been more and more disclosure. However, what has been put in place over decades with all of these emergency acts and the PrEP Act that give complete immunity to pharmaceutical companies and, anyone, physician, pharmacist, whoever, that administered or, played any role in the patient care. I mean, there's complete immunity there. So unless we could prove, to me, it's clear, but fraud and deception, we've not been through this before, obviously, right? Well, I guess maybe back in the Nuremberg days, but I don't know, y'all. I don't know the answer to that, Kat. I guess you could maybe give your thoughts on it, but keep pushing for truth. We need the public to keep pushing for truth and for you not to forget, as so many people have seemed to start, moving on. We can't move on from this until we have accountability.
Thank you. Dr. Kat, do you want to weigh in on that?
Sure. So there is definitely data that indicates, first of all, there is increased mortality. And if you look at the data around the world, the factor that kind of ties off the introductions of vaccines at a certain point, then clinically what we do see is patients who have had maybe stable cancers all of a sudden will have metastasis that are very advanced, or you have patients with no genetic predispositions who are presenting with more advanced cancers. Again, there is one of the things that ties all this in, which is the vaccination. The other concerning thing that we see is myocarditis. We see it in adolescent males specifically. So it's very important for those people who have a child, a teenager who's been vaccinated, if they're having a sports physical, to actually have a doctor do a little bit more of an extensive cardiac workup to make sure that there's no underlying injury to the heart. Girls who see a lot of neurological issues, POTS, which is essentially a presentation where your heart beats very fast, your blood pressure and heart are not fully correlating. People feel very dizzy and they have sustained heart rate over 100 and a lot higher than that. We're seeing atrial fibrillation. We're seeing a lot of things. There's no doubt about it. And from physician standpoint, you always have to ask the clinical history and ask, do they have a vaccine? Now that said, for those people who did get the vaccine but didn't get too many boosters and they haven't had any issues, I would say main thing is don't get another one. Make sure your immune system is working well, and many people don't have problems. For the ones who do have it, I think the biggest struggle is that the medical community is not responding, the gaslighting patients, although I would say that that is changing. So, as a practicing physician from legislative standpoint, what I would like to see, I would like to see the states putting more pressure on medical boards to be impartial, because what we've seen during the pandemic is medical boards were weaponized, and they went after physicians who were prescribing early treatment, or the ones who were talking about vaccines not working and things like that. What we lost is the discourse in medicine, So the same way, the medical board is supposed to protect patients against bad doctors, now we need the legislature to step in and protect good doctors against the recommendation of the medical boards and the regulatory bodies. And that's why seeing more legislature kind of limiting the scope of practice, for lack of better word, the CDC, NIH, the federal, FSMB, which is the federal state or medical board, something like that. And their own medical board, I think is very, very important. I think legislators need to actually start digging deeper into this, because if there is another pandemic, as I'm suggesting, you want physicians who will be prescribing early treatment if necessary or thinking outside the box. We need to stop censoring doctors for having a difference of opinion. Difference of opinion is good, because that will allow us to actually make progress. So those are my comments.
Awesome, thank you. Very helpful. And this next question, I think we have touched on, but if any of you have any further thoughts you want to share, feel free. What is being done on the local, state, and federal level to allow us to have the right to choose our own care and not be forced by the WHO or CDC to do their protocols?
I think it was just for anyone who wanted to answer.
Sure, I'll start with that, okay?
Yep.
I think, again, you guys in Louisiana have done amazing work and we need other states to follow. We need people to realize the power of the 10th Amendment, which pretty much states that anything that's not under the federal jurisdiction is under the state jurisdiction, and healthcare of the citizen is under the state jurisdiction. But there's a problem. States get a lot of money from CDC and HHS and lots of grants, and currently states are getting grants for surveillance of pathogens, and they're also getting some grants from the World Health Organization specifically. So we need to pass more legislature to make this relationship fair. We need to push back on representatives who are trying to expand Medicaid. Specifically, I know that there is a need for Medicaid and Medicare, but specifically Medicaid, but by doing the expansions in the state, you're allowing the government to dictate healthcare in the states. So I think there needs to be more independence from the government, which is difficult because of the budget, and that's why I testified in the New Hampshire against the World Health Organization bill. The problem with their bill was the bill actually said that they wanted, I forget how it was worded, but they essentially wanted CDC out of it as well. The problem is Democrats were never going to vote for it, because as soon as you go after the CDC, they got sprayed. How is that going to affect the funding? But that's where the cancer is. The cancer is in the federal funding. And as long as we have huge size, every state does, we're going to have a hard time. So to truly have independence, I would say, first of all, look for a doctor who is practicing outside of the system as much as possible. I'm retaining all my accreditation, because that's what big insurance. So I talked about the government being the problem today. The other problem is with insurances and insurance commissioner in the state. Huge problem. Another one is the hospital lobbying group. Huge problem. And they all give money to our representatives, and as long as there is this cancerous relationship between all of these groups, we will never have control of our health. So that's something to think about when you're voting and when you're talking to your representatives.
Okay, yeah, I think she covered that beautifully, and I don't have anything else to say on that. I just wanted to, what kind of caught me off guard is because while we were talking about the vaccine side effects, I said, let me check up to date, which is it's probably the largest physician reference that is used widely. And so let me just check on the COVID-19 vaccine site on the section on adverse events and see what it says about that. And who do you think the main author is on that section? It remains Catherine Edwards, MD. It's still under the disclosures. I mean, it looks like she's on more boards now than before, because that image was taken a couple of years ago. So, I mean, if you think about that and understand the beast that we're up against here, it's massive. Because you're going to see physicians and they're using the references that are supposed to be correct. I mean, and it's questionable, right? And so, like she said, formulate a relationship with someone you can trust and find that person now. Don't wait until we have a crisis. Find your pharmacy now, a local pharmacist, versus like a big box.
All right, I have a recommendation on find your pharmacist. Mom, raise your hand. She works at Wolf's in Chauvin. They sell ivermectin if you get a prescription. All right, we have a lot of questions to get through, ladies, so we're
okay,
gonna
let's
just
roll.
try and roll through
Rapid
them.
fire.
Okay, why are so many people and organizations still pushing the COVID vaccine after all of the information coming out that proves how dangerous it is?
Yeah, I mean, because there's a mission here that's not health related. I mean, that's all there's clearly a problem with the vaccine. And there is no excuse for it. Again, we're dealing with the beast here, and I would say that's my opinion. I mean, yeah, it is my opinion, but I mean, the evidence points towards that. And so I'm speaking truth to you, then I'll continue to do that. I can't answer why. Well, okay, go ahead.
What was the question again? I know it, I just want them to hear it.
Oh,
Why are so many, why are so many people and organizations still pushing the COVID vaccine after all the information coming out proving how dangerous it is?
Money,
Yeah,
money. Very simple.
it is.
And the more it seems like the more we find out about the adverse effects. I was talking to a lady here that has just been through the ringer with adverse effects, and she's finally found someone that can help her. But I mean, they're still getting money. And the next time, still going to get money. So we've got to learn to live without the federal government's money. I'm sorry. I don't know how we're going to do it, but that's what
I think Dr. Kat, you touched on this. Do you see another COVID type scenario with vaccines in our future?
I'm sorry, can you repeat that one? Because I was thinking about the one you guys read.
Sorry. And you feel free to answer that one as well. Why don't, if you had something to add to that, go ahead.
So, why are they doing that? Why are you recommending it? Still have no idea. Except to say, we have enough data out there to question. And the fact that they're not questioning it is what we should ask. Why aren't they questioning based on the adverse events that people have reported? In the past, our government and the WHO and CDC, they've all done a good job when it came to pharmacovigilance. Pharmacovigilance is when you have a drug or a market, you look at the safety and concerns, and if you see red flags and warnings, you decide whether to stop something, investigate on what you're going to do. This time around, there's no more here. Let's say it's the best thing ever. There are so many reports where they should say, let's stop it and let's see why people report. They haven't done it, anyone hasn't done it. So the question should be, why are our agencies failing at the primary jobs they have? And I looked at the mission statement for FDA and CDC, and their mission statement is to protect the public. They haven't protected us. And that's something that actually the state agency should look into and go after the agency itself and say, even according to your data, you have enough warning that you should look into it. That's my opinion. That's number one. Number two is the current vaccines that they keep on giving us for no reason whatsoever are for a illness that's going to recycle over and over again. The vaccines are always behind the actual virus that's circulating. So what are you vaccinating for?
Yeah.
Let's say I have a virus currently X, but you're trying to give me the vaccine that's a letter O, and I'm already a letter X. What are you vaccinating me for? You're vaccinating for a distinct virus. And all the person is giving is risk and no benefit. This has been a failure, scientific failure, and the failure of our agency are doing their job. But there's still funding there. You should look at how much money HHS is getting, a lot of money. It's one of the agencies that's getting the most money and restrictions on funding. That's number one. Anyway, I think that's my answer to that question. And now if you want to ask me the second question, I'll be happy to answer it.
Well, that was a great
Sorry, I get a
answer.
little bit heated up of this because pharmacovigilance is important.
Yeah. The other question was, do you see another COVID-type scenario with vaccines in our future? I think you alluded to that.
I don't. I really think that, first of all, they're not even testing the current vaccines. They're just like, oh, it looks good, we're going to approve it. They don't have to do the actual testing. They did at one of the ASIC meetings, which is immunization meeting, where they said, we can do the same thing we're doing for the flu. We can just say, we think this is going to be the strain, let's just put it out. So I don't see a really clear benefit at all anymore. And viruses that are in circulation, they're a lot milder. Most of the time, you really don't have to do much other than have people take vitamins, over-the-counter medications. At times, if they develop bronchitis or hospital, you might have to give them antibiotics and a little bit of steroid support. So it's actually very easily managed currently. So I don't see a need for anyone to really continue getting vaccinated COVID-19 vaccines.
Thank you. I'll just keep rolling with you, Dr. Cap, for another question. Do you feel that doctors in general are still on board with this vaccine lie?
This is anecdotal, but I'm hearing from friends who are saying that their friends, doctors, are saying, I see what you were trying to say, and most of them are not recommending vaccines. But then I've also attended a medical society meeting in a county where they're all coming home. So I think it's kind of mixed bag, but in my opinion, if you have a doctor who's still recommending them for no reason whatsoever, I would truly look into getting someone who's more open-minded. And this is to say that I'm not one of the doctors who's completely saying every vaccine is bad. I'm not there yet. I think everyone should read the book thorough all the way down to understand the corruption of the vaccine industry. But I still see that there are some that have effect, especially with certain group of people. And I'm not there yet, but I'm saying let's get rid of them all. I think we need to reinvestigate them and make sure that their safety profiles are correct and not exaggerated. Because one thing that has been exposed in the past 4 years is the fact that pharmaceutical companies are extremely corrupt. In many cases, most likely they have falsified data and not truly done the studies that they say that they did. So I think that's something, again, that our legislators could legislate. And I hate that we have to legislate everything, right? But there is so much corruption that someone has to do something.
Yeah, thank you. Would you mind repeating the name of that book that you recommended?
The turtles all the way down.
What? Turtles all the way down. Turtles all the way down. Okay. Thank you.
You get turtles.
I'm going to skip over a few that I think we touched on since we're pretty tight on time. Here's another question about about, kind of related to COVID, what is shedding and how does it affect vaccinated and non-vaccinated people? Dr. Willis, do you want to take it?
There's, controversy, or at least initially, on whether shedding was occurring, but as far as the latest that I've seen, shedding can occur. And basically, it would be the protein of one of the vaccines, especially if you're in close contact with someone who was recently vaccinated. So, what's the actual question? I'm sorry.
How does it affect vaccinated and non-vaccinated?
Vaccinated as far as you be the one shedding it?
There's not that much
Oh,
detail.
all right, that's okay.
All right.
It's okay. I mean, I'll tell you this. I kind of wish my daughters hadn't been in close contact with some family members after, because we're broadcasting this. Maybe I shouldn't tell that story. Okay. It's not bad, but I mean, there were some physical changes that occurred, and that was disturbing to me. Like, it was shocking. And so I believe that it actually does happen. And this science, I hate saying that word now, but the research apparently is showing that it can happen.
All right, thank you. If a person has taken the original vax and no booster, what plan of action could be taken to remove this poison from our bodies?
I think Kat has a very passionate reply to that question.
Dr. Kat? Dr. Kathy's calling on you for that one.
Can you repeat the question?
Oh, sorry. Yes, ma'am. If a person has taken the original vaccine, no boosters, what plan of action could be taken to remove the poison from our bodies?
So some people will claim that there is detox, there is no detox. Someone tells you there is detox, they're lying to you and they're trying to make money off of you. That's my opinion, so thank you for all the work, that work on. Now, that said, I do think that one way we can help, if you have a severe vaccine injury, then there's one more expensive thing that you may have to do. I'm a still firm believer of traditional medicine, and if you combine it with some other options out there, I think there are answers for those people who are extremely injured. I do recommend React 19. It's a 501c3 organization that's run by vaccine injured. One of them is a physician, Dr. Walcott, the good friend, and we actually are working on setting up some clinics for people who are fully vaccine injured and are struggling to find care. That said, for anyone who feels like they need to find answers because they were vaccinated, now they're having some effects of it or none, I go back to the immune system. Fortify your immune system. You can go to your doctor, check your vitamin D levels, you make sure that your vitamin D levels are about 60, 65. Eat healthy foods. Recently, if you follow me on Twitter, you're going to see that I made milk out of I made butter out of raw milk, which was an interesting experiment, and I have to say, it tastes delicious. I also love kefir. Kefir is kind of acidic type of a yogurt drink, but it has the most active bacteria, bacteria, which you need in your gut to protect your gut and actually mitigate the symptoms of vaccine injury as well. Because the spike protein, the nanoparticles, they kill the bacteria. So there are many things you can do to get your immune system to work well. That's the most important thing. If you get sick, take vitamin C, elderberry, zinc, and acetylcysteine. I don't recommend, there is also kinase and these other things. taking all of these things all the time. Because too much of good thing is bad, essentially. Because if you're taking too much zinc, then you're going to mess up your copper and other things. So you kind of have to be careful. But I am one of those people that's like common sense, right? If you're sick, you know, I'm from Europe. When I'm sick and I post something on Facebook, the first thing I get is the messenger message from my sister, did you cook certain foods? Because what we eat, what we think, what we do, the food we get, is really how you repair your immune system. And then if you need extra help, you can always look up the things that you are missing and take those things. And I hope that helps.
Beautiful answer. Thank you, Dr. Kat. I'm wondering if we can buy like 5 extra minutes to get to some more questions. I don't know. I'll just play the boss and keep going.
Yeah, if they want to leave, they can leave.
Yeah.
If they want to stay for questions.
Yeah, absolutely.
Say that out loud.
Okay, fair point. If you have somewhere else to be, feel free to leave. We're going to get through a couple more questions, so we don't want you to feel like you're being held hostage. You're free to go at any time. And thank you all so much for coming. We'll do a proper closeout, but if you have to leave, thank you so much for making the trip tonight. Okay, this one's for Representative Edmonston. Why in the mandate bill was COVID-19 the only thing mandated? I think probably your HB 46, yeah.
Yes.
Why?
That was the only.
Why did, like, for instance, why wasn't future E-ways or something?
Actually, somebody, I think, broached an
Use the mic,
amendment, and
please.
it was not going to pass.
Use your mic, please.
Oh, sorry. Because all vaccines, the will of the legislature just wasn't there for that. But we may bring that back next session, sure, yeah. Can I say something just real quickly?
You can.
Okay, what?
1 second. And
okay.
Dr. Kat has to leave us, so
Okay.
thank you, Dr. Kat, for your time and for your insights.
Yes, thank you.
We appreciate you so much, Dr. Lindley.
I just wanted to say real quickly, remember when Dr. Willis says that we, as a state, we're not doing well in preparing for a pandemic. I think that's because we are not woke, and we have come to learn that, you know, we're going to believe what we know is true and not what somebody tells us, like the government. The second thing I wanted to say is, do y'all know that overall, I don't have the statistics, but we, as a state, are low in vaccination rates. Did y'all know that? That's awesome for us. I mean, really, it is. Our people had common sense when some other states, and I'm not going to name any states, but I mean, we did really well in utilizing and processing the information that we got that was good information.
That's great to hear. And Vicki just mentioned that maybe not everybody could hear what Dr. Kat was saying, so I'll do my best to repeat it. But basically, she was saying she's very common sense. She's not a person who believes that you need to take vitamins every day of the week. You should take them when you need them. If you're sick, the best way to deal with your health is first think about what you're putting in your body, nutrition and food. And what you're drinking, and then supplement after that. And then, of course, if you need more medication after that, you know, that's when you would add it on. Did I miss anything else? I know she talked about kefir being a really,
yeah.
It's a yogurt drink that's got powerful powerful bacteria to repopulate your gut, which would help your immune system. Yeah, and check your vitamin D levels to make sure your immune system is good and strong. It's KEFFIR, I believe. Something close to that.
KEIFER.
Okay.
KEIFER.
Okay, just a couple questions left. What is the best protocol to receive a safe or unvaccinated blood needed for a surgery? Are there any guarantees of clean blood? I'm hearing that self-directed blood donation can be denied by the physician or the hospital.
Yeah, so there, I don't know if it's in, what state it was, or is, that is, or maybe it was here. Somebody's starting an unvaccinated blood bank. Have you heard that?
I haven't heard that.
I'll check into that for y'all and let y'all know, and I'll send it back through the channels here. But, it's a great question, because I have the same question. Because there's been reports of, you know, people having issues after receiving the vaccinated blood. I haven't heard the report that was on the card there about hospitals not allowing you to auto-donate, so to speak, or, you know, to save, self-donate, to save blood for yourself. But it's a great question, and it's something that we need to address, legislatively, or we need to look into it and see how we make that happen. So I'll get back with y'all on that. That's a great question.
Thank you.
Called SafeBlood.org. SafeBlood, Kelly DMP on Twitter.
Oh.
They started that.
Oh, okay.
It's a monthly subscription, but you know, you're hoping they're being honest.
Yeah, right. Okay, thank you. She was giving us a resource to check into.
Yeah.
Okay, all right, why don't you do that? We want to get to some of the bills that Representative Amade brought.
Yeah. And of course, y'all all know Representative Amade because she's most of your, I guess she's most of your representatives, right?
Yes.
She's not LaFouche, but Terrebonne. Yes.
Some of those.
Some of LaFouche, okay, good. Okay, so Representative Amade, I want to let you know what she brought. Okay, she brought House Bill 958, did not pass, but would have prohibited insurance companies from providing either incentives or penalties to encourage healthcare providers to push vaccines. And our own, as we've heard, our own LDH did that to a great degree. Incentives, I mean, what did they do, y'all? Sandwiches at some place and credit cards.
$25, yeah.
Yeah, I mean, it was unbelievable. I want to say, but that didn't pass, and I just see we gotta bring that back.
Kathy, does everybody know what LDH means?
Louisiana Department of Health is LDH. Everybody knows that? No, you do. HB 908 prohibits discrimination against a student based upon vaccine status. And that passed. That goes back to, remember, well, maybe you don't remember, but kids, for instance, right in the throes of COVID, some schools were making children that were not vaccinated sit in one room, and the other kids were not, didn't have a little scarlet X on them, and they could go around and be with everybody. So that's really, I think, where Representative Amade was going with that. It did pass. So in case we have something else, we had that in place. HB 866 did not pass, but it would have outlawed retaliation by a person, a business, an employer, school, a bank, government entity. So it would have outlawed retaliation against a person who refused a medical procedure. So that's kind of the same thing as what I was saying. Retaliation, I know one of the hospital systems had their people that were not vaccinated really wear an X or a cross or something. And that, again, that's what she was going after. That didn't pass because probably people didn't even understand what she was talking about, but it happened. HR 292 was a resolution that passed requiring the Louisiana Department of Health to send us a report that matches up since deaths of babies under 2 with their immunization records. And everybody, not everybody, but they went nuts in the legislature. Why would we want to do that? I mean, seriously, just all you would do is just gather a little information they probably have anyway. So we still need to pray for a lot of people in our state that don't see things the way we do.
So that didn't pass.
That did not pass, yeah. I'm sorry, that was a resolution that did pass, But HB 288 is what I was thinking of. That would have required coroners to include immunization records in the autopsy reports of SIDS deaths of infants under 1 year old, and that didn't pass. It came really close to passing too, but people didn't want to tell coroners what to do.
And SIDS is sudden infant death syndrome.
Huh?
Sudden infant death
syndrome, yeah, that's what SIDS is. And then this last bill, HB 357, this passed. This is has to do with CBDC. Does everybody know what that is? Digital bank currency. Okay. When the feds launch a U.S. central bank digital currency, which it looks like they really might do that, this bill provides a window of opportunity for the legislature to determine the regulations for how a CBDC will function in Louisiana. So that means that we're going to be able to, as a state, say, you know, how we want this to flow instead of taking our orders again from the federal government. So she had some real good legislation, and all of it didn't pass, but a couple of 3 key pieces did pass.
Thank you.
Okay.
Appreciate that.
Yes.
All right, a couple more questions to go. Have either of the doctors had patients with hereditary dementia and Parkinson's getting those sooner because of the COVID vax?
There's definitely a rapidly progressing dementia that I've noticed after vaccination. Pretty evident. Parkinson's, seeing more Parkinson's. So yes, I mean, it appears to be, increase in those and rapid progression of those.
Thank you. That's terrible.
Yeah.
Representative Edmonston, what about the abortion pill? Is it legal to sell in Louisiana? And I know you can call on Debbie Melvin for a backup.
I'm going to call on her right now. What happened with that?
Well, it is illegal.
Come up, Debbie.
You're gonna have to take
Here,
her
come
mic.
up here. Yeah, because that's important, and we went back and forth so many times, I don't know exactly what we decided now.
Debbie is the chair of our legislative committee and a passionate advocate for pro-life issues.
It is illegal to sell it here. In other words, a doctor, an OBGYN, whatever, there are no abortion clinics open in Louisiana anymore. So they cannot prescribe it here. It is illegal. However, it is readily available online. And it is coming from India and China, and they are, I mean, these pregnant women evidently are that desperate that they will trust a drug that comes out of a foreign country. And so I would tell y'all, we have 2 pregnancy resource centers in the area. There is one in Homa and there is one in Thibodaux. The one in Thibodaux is called Crossroads Pregnancy Resource Center. I'm on the board. And the one in Homa is Hope Restored. And if anybody needs information, help. I mean, it's help. If a girl finds herself pregnant, she can go to one of these places and they can help her for 2 whole years if she decides to keep her baby, providing what she needs, whether she needs a place to live or food on the table, whatever she needs. So it is not a hopeless situation. So I would tell y'all, if y'all see any of this coming, you know, in your circle of influence, make sure you tell people about those pregnancy resource centers. And as far as the abortion pill, it is, I mean, they're saying now that up to 60%, 63, I think I heard the other day, of all abortions in this country are done by chemical abortion. It is a horrific procedure. The people are not told what that experience is going to be like, you know, completely, and it's a very, very tough thing. And women are presenting at, y'all may be getting more information than y'all really want, but women are presenting at emergency rooms because they have taken that pill and it has caused them to hemorrhage. And they have nowhere to turn because they've gotten it online. But even if there was an abortion clinic here, they won't see them if they have a complication from a chemical abortion. They show up in our emergency rooms. And then it's all secretive, because it's illegal here, so it's all secretive that they won't admit that they have, taken that abortion pill. So they can get help at the emergency rooms if they're hemorrhaging, but we're not counting. We're not keeping up with those numbers and saying that, we're having X number of chemical abortions in Louisiana. We have no way of knowing or tracking that.
Debbie, do you also want to mention Senator Presley's bill, the two drugs that were added to the schedule? Or-
Right. Senator Presley's bill made chemical abortion by fraud a crime.
Yeah.
And so, I won't go into the story, you can look that up online, but basically what it says, if you are caught in possession, except a woman who is pregnant, who has gotten this chemical abortion pill, but a man who is found to have either one of those drugs, it can be the mifepristone or it can be the misoprostol. So either one of those in their possession, it is considered a Schedule IV drug, which means it will be treated exactly like heroin or amphetamine. What's the other one? Fentanyl, whatever they are. But it will be treated exactly the same because they should not have those in their possession to use for, girls that they're trafficking or, any other situation. They should not have those. So it is a crime to have those.
And there is a penalty connected to that.
And there is a penalty, like it's 10 years.
Yeah, it's pretty steep.
Yeah, it's pretty steep if you get caught with that.
Thank you, Debbie. Appreciate it. I'm going to come back to this one maybe because we touched on it. The timeline for the bird flu pandemic, it sounds like Dr. Kat thinks it's pretty imminent,
It would have to be.
sometime between now and the election.
Yeah, or the day before the election. Oh, we haven't had it.
Well, no, they have to do it now so we get mailboxes,
Yeah,
drop boxes.
Maybe this is one that if anybody has recommendations, they can raise their hand, but can local citizens share local doctors who they can recommend? So maybe if you have a recommendation, raise your hand and people who are interested can talk to you after. Does that work? Y'all, you got maybe turn around and do a quick, so they can really find you after. Perfect.
Yeah.
Thank you, Shannon.
That's great.
See what I mean? This group
Yeah.
is so wonderful.
That's awesome.
Just love it.
Okay, is VAERS a reputable site?
It always was until COVID. So yes, I mean, there's a lot of information there, and it's the gaslighting that it's just like not that good now, or it was not reliable during COVID is just completely false in my book.
All right, 2 more questions and then y'all are out of here. What are some things reported that were caused by vaccines and boosters? Example, brain tumor or glioblastoma.
What are some things? What do you say?
I guess maybe some adverse events.
Many different things. A lot of vascular injury. So aortic aneurysms, brain aneurysms, because there was a lot of inflammation, it caused a lot of inflammation around the blood vessels. And so clots, obviously we've seen a lot of that. We've seen platelet problems. Myocarditis, of course, yes. A lot of neurologic. It's autoimmune, the body's attacking itself. And so seizures, dementia, psychosis, miscarriage, strokes. So, it really just runs the gamut. Rashes, Guillain-Barré, which is, paralysis, and, I mean, you name it. I mean, there's a huge list of adverse events, but I would say the most common thing that we've seen is the myocarditis and then the vascular-related events, heart attacks, strokes, blood clots, in many different places, strange places, cancers, you name it. I mean, there's just been so many different.
Thank you. Okay, and last question, who oversees the state medical boards?
It's the LDH, right? I mean, it's in the law.
I guess.
Say the
So, I'm sorry, so it's in our code, in our, whatever you call that, Kathy? Codes of law, but yeah. So essentially, I believe it's LDH, but I think that there was a push to change that. I don't know why I'm looking at you like you have the answer to everything, sorry. I'm deflecting. No, because I don't know the answer. But I do know that it's in law, and I believe that it's the LBH, Department of Health, or Office of Public Health.
Thank you. Well, I hope that you would join me in thanking Kathy and Kathy for Thank you so much. And just a reminder, we will be having an event in August. Check the calendar, check WTPBayou.org. Again, it's Dr. Kate Brumley, the Superintendent of Education.